there are interventions that are being made towards the health sector, but it is not enough. And reasons why these interventions are not enough is because the issues have been allowed to fester, they've been allowed to take root, and then they've been allowed to drag for a very long time and became so enormous, coupled with the fact that we have uh, health institutions that have been in place for several years and several decades, and then there are no improvements in those health facilities. There are no additional health facilities that are viable. Viable in the sense that it is not just building structures that is health facilities, ensuring that it is well equipped, one, and then ensuring that there are qualified, experienced professional personnel to be able to take care of those patients in the hospitals is what brings about the viability of health institutions. So when these are not provided over time, and then we have that population surge, population increased, almost much more than it used to be, then you imagine the kind of burden, the kind of weight, the kind of pressure that is being put on these health facilities, and that is what is happening to Nigeria at the moment. So when we want to solve this problem, it has to be holistic. Holistic in the sense that we look at critical provision of critical infrastructure from primary healthcare centers to secondary healthcare centers and tertiary healthcare centers, and then to also ensure that there are enough personnel. And then we all know that in recent years we faced a syndrome that has to do with the exit of medical professionals after being trained in Nigeria. They try to find greener pastures elsewhere, especially in Europe. Most of our nurses and our doctors are looking for where to get their trade fly in especially United Kingdom. That is where most of our doctors and our nurses go to. Why? Because there are better work environments, there are better remuneration, better exposure to health facilities and equipment, and that is what we lack. Now, what are we doing to ensure that these doctors do not continue to exit Nigeria? These nurses do not continue to exit Nigeria. Is to ensure that we have good remuneration for them, is to ensure that they are exposed to good facility, good equipment in the hospitals so that they can ply their trade and then become as professional as they want to be, and then they can have job satisfaction. These are issues that needs to be on the table. But if you look at it, it seems like we're not giving it that holistic approach in solving the issue. We just throw a drop in the ocean and then begin to blow it up to look like we're making very good interventions. And I think this is what is drawing us back. And apart from that, there are also incentives that we can use to draw in private sector participation, especially the issues like the Avon, the hospital that is being commissioned, and they're doing their best to bring in certain interventions in that sector. So if we ramp up private sector participation and see that we have major specialist centers across the country, this will do good for us. But beyond that, the government has to be deliberate, has to be conscious about it. It is not wrong for us to have specialized centers. Even if it's just for certain ailments, we might not be able to say, okay, we are taking a broader perspective that all the ailments will have specialized centers, but we can have a general medicine improvement in all our hospitals, and then try to see that, okay, as medical sector in Nigeria, specialty should be given to these certain areas, world best equipments, the world trained doctors are in that area, and then it could be an area that could attract other parts of the country. Instead of exporting, we will also be able to attract tourism to the nation, and then attract also foreign exchange. For instance, if the nation Nigeria is known for giving expertise in heart-related issues all across the world, people will be flying into Nigeria to get attention in health in heart-related issues. If it is in pediatrics, people will be so things like that. And I think that this is a strategic approach that we need to deploy. But then generally, I don't think that enough is being done, especially in the area of ensuring that our trained doctors are not allowed to exit. You cannot force them to stay, but the only way you can make them stay is for them to have good working environment, have good remuneration to ensure that they are comfortable within the country, and then you have very, very few of them trying to exit and get themselves. If they are going to get almost the same thing, going to the United Kingdom, why not stay here? Why go through the stress when the remuneration and the working environment is going to be the same? So these are strategies that we should put in place. But we have failed in doing that in recent years. But we must be conscious about that because health, they say, is
It's
wealth.
wealth.
And if we don't have a healthy population, then that tells you that the output of our population is going to be depleted. The output is not going to be significant, and then we'll have issues. You can just imagine how many people have not been able to, will not be able to access healthcare, and then will have to lose their lives on and even common and simple ailments, as simple as and common as malaria is. There are no adequate intervention in that area for the common man and for the poor. And then the country has tried in recent past to deploy certain systems that has to take care of free medication for a certain age, maybe 0 to 5. Let me say, I know that there has been that campaign, and then nursing mothers having to access free healthcare. But how effective has that been? The review to ensure that it is as effective as it is designed it is what is lacking. We always, almost, and most of the times, lack a review mechanism to ensure that implementation is above 90%, and that has been a challenge in our nation, Nigeria. So this is my perspective about the challenges of that we are facing.